What I'm getting at is the earlier you see a practitioner, and if you have a good relationship with your practitioner, they know you, they know what formulas you've had before, the treatment the second, third time around is generally a lot quicker, less expensive, and, more succinct than whatever you had the first time around. In this video, I want to talk about 3 ways that you can use acupuncture, use Chinese herbs in your life with a practitioner. Let's get started. I'm Marie Hopkinson. I'm a herbalist and an acupuncturist. I've been practicing Chinese medicine for about 22 years. And in that time, I've seen different ways that patients make use of herbs and acupuncture, make use of practitioners. And I want to talk about those 3 ways and how they might be useful to you, beneficial to you, because you might be doing it one way and not realize there's other ways you could be using it. So the first way is like the urgent. Okay, something has happened and I've got to address this urgently, right? Now there's no shame in using it any of these ways. You might have a pain. If you need pain relief, you've got to go. You've got to get the treatment straight away. Like your back's gone out, you've got a UTI, you've got, something extreme has happened and your body's saying, pay attention to this, like I need help right now. And pain comes to mind because it's something that people commonly seek acupuncture for. But for herbal medicine, all kinds of urgent conditions can kind of be sorted out with herbal medicine, for instance, right? So something urgent has happened and you go to that practitioner and you kind of get a relief of those symptoms you came for. And sometimes I see patients then move to the next stage of the treatment, next stage of using a practitioner, or they drop away. Now, they might drop away because they didn't use it long enough to get a result. The cost might have been more than they thought it would be and they just simply can't afford to keep coming for any treatment. Or the problem that they came for is resolved. For the most part, that's usually what I find is, not tooting my own horn here by myself. Toot, toot, toot. I'm just saying that it is a common thing where you might have had, let's say you had sciatica and the pain's gone away. You don't have the sciatica anymore. But there might be other things that your acupuncturist or your herbalist could do for you that would either prevent the flare-ups from coming on or work on other things that are related to your health. Maybe that's not as important to you, or you don't realize that acupuncture or herbs could help with that. For instance, gut health, digestion, sleep, energy, things like that. Particularly with herbal medicine, and particularly with the style of herbal medicine that I do, we have a kind of a pretty comprehensive following up system with the herbs. So you take one formula and then it's like almost you need to take the following up formula to complete the process. The patients will still feel good. Like you'll still feel good after that first formula, whether you take the second one or not, provided it's the right formula and it's done its job, for instance, right? But there is more that you could have. There is more to be had. So that's one of the ways. And the second way that there is sort of maintenance with a continued support with the practitioner. So I see patients use Chinese medicine like this. They might come in with that urgent thing and that's resolved. And then they keep seeing the practitioner to try to get better and better or to see what else could be done, right? And this may involve being seen in the clinic with your practitioner once a week, once a month, once every few months. There's some kind of booked system that you have so that you don't drop away, so you don't fall away. Why is that important? One is because it keeps you accountable. If there's stuff you've got to do at home, one might be taking the herbs, right? I have patients, believe it or not, people do buy herbs and don't take them. And there can be lots of reasons for this. Maybe they forget or they actually start to feel better and they just stop taking them or they forget to take it. Now, we don't actually believe in Chinese medicine you should have to have herbs forever. Like, that's not the premise of the medicine. Like, oh, you need to have herbs to sustain your life and keep going, right? No. But if there's something that isn't completed in the treatment, like something that's still there, like your sleep isn't great still, or your energy isn't what it should be, or your performance and function in the bedroom isn't as good as you would want it to be, or your even mental health, right? That's not as good. Or you've got anxiety or, a lot of, mental distress or, your stability in that way isn't as good as you want it to be. They're all things that herbal medicine and acupuncturists can kind of work on. So they can keep being worked on. There might be stuff that the practitioner gives you to do at home. And this brings us to the next thing about accountability. So if you come and see a practitioner every so often, they're going to ask you, oh, did you take your herbs? How did you go with that diet stuff that we talked about? How did you go with the exercise that we talked about? It kind of similar to if you go to a physiotherapist and they give you exercises, rehabilitation exercises, and you didn't do them. Well, the muscle isn't going to rehabilitate on its own. So there's a kind of a check-in that's there. And I like it when my patients do that. But I'm also happy if they go to the next level of use of it, which I would say is kind of a maintenance level where the patient has a high awareness of when they need to come in for that check-in. So they might not necessarily be booked in to see you all the time, although I have patients like that. And knowing whether this is right for you, this self-care, self-check-in maintenance versus the continued support maintenance, maybe has to do with your personality type and how aware you are of things. Like if you are the kind of person that's let things go, you're probably going to keep letting things go in the future because that's your personality, that's your type, that's what you're like. You're like, oh, I just ignore it until it's like, whoa, it's urgent. And so these two phases are kind of like try to avoid it to become urgent. Now, sometimes that is in itself unavoidable. Like if you trip over and fall down, yeah, you're going to hurt your back, and maybe we couldn't have avoided that with regular treatment. But the severity of the condition might be not as bad because you've strengthened your core with exercise, or you've lost some weight and that's helped you. Your recovery from illness, like accidents and illnesses like that, is certainly better if you have the foundations there, like your digestion's good and your sleep is good. So those two foundational things helps your body absorb nutrients better. It helps it do the repair and the restoration that you do when you're sleeping. So they're all things that if they're not great, were something unfortunate to happen to you, then your recovery is going to be heaps less. It's going to be heaps harder, more arduous than have those things been already good. So we're trying to avoid the urgent need. Now, another way to use that self-care, self-check-in maintenance might be to book an appointment, but just spaced apart, even once a year, right? It's better than no booked appointment. So you kind of just have a check-in with the practitioner. Hey, this is what things are happening. And you may not think that things have gone out of balance or that there's not an urgent thing. And that's great. It's good that there's not some urgent health thing. But actually, acupuncturists and Chinese herbalists think about a lot of symptoms as being important that aren't urgent. So for instance, like you've got a chronic loose bowels. It's not like diarrhea running to the toilet urgently, but it's still important to address why that's happening. Or bowels are starting to skip, or maybe there's a bit of abdominal discomfort, like, in your abdomen, you sort of feel, I feel a bit tight, feel a bit uncomfortable. Right, let's address that before it gets to something like kind of like pain. So that's kind of 3 ways you could use an acupuncturist or a herbalist. You can go when it's urgent, and you tend to need much more treatments at that point, as in you need to do the treatments regularly. Obviously, every condition is going to be individual, so I can't blanketly say, oh, you're going to need 10 treatments or you're going to need 5 treatments. But if you've never seen a practitioner before and something's urgent, the worse it is, the more treatments you need to fix it. That's kind of the way that it works. When you've had acupuncture regularly, your body's used to kind of taking herbs, or you get it straight away, as soon as it kind of happens, then you generally don't need as much treatment. So let's use the example of a patient with back pain. So let's say I've seen someone at the urgent stage, they've had bad sciatica, they can't move, they can hardly get out of bed, and we've done treatment. We might need to do treatment, 2 or 3 times a week, let's say. And a few patients kind of come to mind when I think about this. Like, it's a very common way of treating things. And most research papers for back pain, for lower back pain, suggest that people need, once a week, 5 treatments a week for 2 weeks, 3, like that kind of 3 weeks worth of treatment, something like that. Not every single day, but in many research papers, they do it very regularly like that. So let's say they come in for, maybe 9, 10 treatments over the course of a month, something like that. Maybe 3 times a week for the first couple of weeks. I'm talking about someone who's got very bad urgent pain, right? Very, like a prolapsed disc or something like that, really bad. And then it resolves and it's better, right? And they might be fine for ages after that. They may not be. We can't say for everyone that's going to be the same. But this is a common kind of thing, what happens with acupuncture. You feel good. Generally, like I can go back to your normal stuff. And you're like, yeah, your life is good. And then depending on the cause of the problem for you, in general, most of the time, I don't know how to give that many caveats for it, but in general, before it comes back to that severe pain, it starts off with tightness. So it's about making the patient, for me, I have to make the person aware that you've got to notice when the tightness comes on and have a treatment then, rather than waiting until it's like severe pain. Now, sometimes people do wait till it's that severe pain in that circumstance because of financial reasons. They might think, oh, look, I don't want to waste money on a treatment I don't need. But if you have a known condition, you know that you've got arthritis, you know that you've got some kind of degeneration in your spine, like an arthritis situation, or you've had a prolapsed disc in the past, or you've had something, you know what the severe pain is. It's better to treat it earlier and for it to not have been anything severe than to wait until it's super severe, and then you will have to have more treatments then, because it's kind of just the way that it is. So they're the three different ways you can use Chinese medicine, right? Now, when we talk about herbs in these ways, we're treating the urgent situation, then we have the kind of the maintenance treatment, and if you regularly check in with your practitioner in that stage, they can tweak that formula for you to make it better and better. Like that's what I would do with my patients anyway. And they might stay on those herbs for months and months and they're okay. And then, if something happens, we kind of tweak it as we need to. But in general, you'll come to a formula. It's like a maintenance formula for you, as in it's your constitutional, it's supporting your body's constitution and also supporting you in what you do. So for instance, I have some patients that they just can't get the sleep that they need. So their body's kind of sucking up the goodness of the herbs because they can't really restore their body that well through sleep. Or you go through a really busy time and you're not going to be able to sleep as well as you normally would. You're traveling a lot, or you're placing a lot of strain on your body in some way, physical strain or something, like an athlete or something. So you can have formulas that kind of support you in those needs at those times, right? And then, there'll come a day where you don't need to take the herbs anymore, right? And that's got to be something that you have in consultation with your practitioner, and you decide, okay, we'll just see how we go now with no herbs, no treatment, and then if it comes back again, they can come back in and see you. Or the dose is just very low. Like we can make the dose pretty low, and you just kind of stay on that. The other way I see people use Chinese medicine in that way is they have a maintenance formula and they forget to take it. They stop taking it. And they feel okay for a while. Like they probably could have felt better if they'd have stayed on the formula. And then the original problem comes back. And it's up to you to know, like I said, with that, that self-care maintenance thing at that point where you've got to go, okay, I got to book in now. I've got to come in now and take care of this as quickly as I can, even though it's not like super duper urgent in terms of the level of pain and discomfort that you have, so that it doesn't become like that. Right. What I'm getting at is the earlier you see a practitioner, and if you have a good relationship with your practitioner, they know you, they know what formulas you've had before, the treatment the second, third time around is generally a lot quicker, less expensive, and, more succinct than, had you whatever you had the first time round. So that's kind of how you can use Chinese medicine. And I hope that this helps you understand how to use your practitioner. So hopefully you can find a good practitioner that you respect and that you are able to use in that way. There's no shame in using acupuncture and herbs for those urgent conditions. Sometimes I see that's all that people can seem to manage, and they maybe can't afford to do the other stuff, or they just don't really want to make time for that in their life. And they just go back to doing whatever else they were doing. And then they come in, and I have patients like that I might not have seen them for 5-10 years. And they're like, oh, my shoulder's sore again. And you fixed it like 10 years ago. And yeah, and they just come back in when that old thing comes back, if it does come back, this kind of thing. So that's okay. And I'm sure that many acupuncturists, if you're an acupuncturist watching this, you have patients like that too, that kind of come in like that. Ultimately, what we want to see is for you to get better and for you to not need us anymore. Like, I don't want patients to be sick all the time. I want you to be better. I want you to be well. And once you can get onto a herbal formula where you do feel well, I love it when we can kind of tweak the herbs to make you feel even better, to increase that wellness, rather than to just be treating sickness. And that's really great, because that's when you feel amazing and you feel like, yeah, I feel better and better and better, not just the same, right? Life can improve. And it can take a while to get there. Like, if you've had a situation for a long time, it can sometimes take years before you get to that point where you don't have those symptoms bothering you as they were at the start, and you're feeling that you are in a state of wellness rather than in a state of treating the sickness. Anyway, I hope this has been useful and helpful to you. And if it has, make sure you click that subscribe button. I'd love to get to 10,000 subscribers this year. I don't know if it can happen, but it can only happen if you click it. And there's lots of people that watch these videos that don't subscribe. So I'm speaking to you. If you haven't subscribed yet, make sure you click that. And I'll see you again on another video soon. If you have a question about Chinese medicine, you can ask it in the comments below. Thank you. You got to come in and see me, and you might not know. No, I'm going to need to sip this water.